I just got requests for videos. If you need a video, please let me know, on pregnancy. One of the problems is that people don't realize not only is pregnancy a development of your system that you're not used to, but a lot of my parents, obviously like me, I didn't have to have a C-section, but a lot of the emergency births that happen are with a C-section. So once a C-section occurs, we can't have another natural delivery. Yes, there are some cases, but I'm telling you now, for those of you who like to comment, if you dropped a child at 2 months premature and they spent a couple of months in the NICU, chances are your doctor is not going to do a PVAC and try and deliver that next child naturally. Even despite a de novo situation or a stressful situation at that time. But what I want to do is start getting the baby healthy now, and for you to understand what happens in the uterus as far as I'm concerned with my area of physics and where I've presented on my gravitational. Now, a lot of people think that gravity is the same in the womb. Yes and no, and here's why. First of all, for you and I to move, we have rotation. Anything, if I go to get up, I have to have a movement with rotation. Yes, I can lift my arms up straight, those are adult movements, but when a child starts to learn and move, and all of these moves that a baby does, they have areas of rotation, and depending on how they use the movement. Babies also have no calcification, especially in utero. They have more bones. They are subluxed, they come together. Another thing that happens in the womb that does not happen here is with the amniotic fluid, and also, I'm saying this loosely, lack of organ function, meaning there's no breathing in the womb, there's no digestion. Yes, your heart works, your kidney works, but still at a very low grade. Your body is meant to expand in the womb. And the reason I know it's a neurological factor is because this is what happens to astronauts when they've been in outer space too long, because again, they do not have the weight of oppositional gravity, not of gravity, of oppositional gravity on their system. They then go back into expansion mode, and that's why your bones start to grow, your body starts to grow in outer space. It's not lack of muscle function. The space program is completely wrong, and I'm working on that paper, but it is about that your body is in expansion mode, and I believe that there should be no friction, no kind of issues with that. That's why you'll see a baby like this in the sonogram, not like this. When you start seeing friction, cord around the neck, we start getting into stressful situations on that system because they are still in expansion mode and now they're being in compression mode, which really does not happen until the last month of pregnancy. So that's why a premature labor and those kind of things are harder on the body and harder on the baby because, again, they're in expansion mode. The brain needs to develop and grow equally in all directions. So that's why when we have a premature child, then you'll have issues with the bone densities, even though we're moving the child around, because their system should still be in expansion mode, and now we have them in compression mode. So that being said, I'm saying welcome to your new body again. You now have a uterus that's starting to form. Again, a lot of people that will be doing this, I have C-sections, not everybody, but let's say I had appendicitis or I had this. We have scar tissue, however you want to look at it. In most cases, you will have more with a C-section depending on where the cut was done and the size of the baby when it was coming out. A full-term C-section is going to have more of an impact than a premature C-section for, let's say, a 2-pound baby. But again, if it's an emergency and they're going in there, these are the things that are happening. So there are a lot of techniques that do, let's say, a pelvic clock. But what they think of is more the dial around your tush. Now, pelvic clock, for those of you who don't know, 12, 6 o'clock. So I go 12 to 3, down to 6 to 9, and back up again. And I should be able to move like this. But what I'm going to do here with the pregnancy is I want you to consider the counter of the uterus. Now, your uterus is going to grow. You're going to have an increase of body mass weight of around, let's say, anywhere from 20 to 40%. So you have neurological changes that happen, hormonal changes, but also system changes. One of the things that happens with women, and this lesson would be great for post-baby, is that, again, it's bringing that uterus back into your system. That's why a lot of people like to say, oh, look at this, look at this. This is me, this is not a this. But we tend to look at the uterus part as a third party in women, and men don't have that issue. What I like to do, now, honestly, cheapo swimming tube with barely any air. This actually might be a little bit too much air, but I'm going to put this in here. But what I'm going to be doing is just giving a little bit of air in here, right? So what I'm looking for is the float. So when I float, and I'm going to bring my hands up, sorry, just so you can see my pelvic region. I probably look like I'm pregnant, so sorry about that, working on it. But there are different ways that we're going to be approaching bringing in this baby. So one of the first things we're going to do is work on the float. Now, if you feel more comfortable with your legs up, your head on a pillow, please, this is about your comfort and what you're doing here. Well, the first thing I want you to work on here is, I just want you to see what it feels like by dropping the left hip down and dropping the right hip down. You might feel that one side wants to fall more, as an example. You might not notice much. You might feel you have to do more with your knees, your feet, your spine. Right now, it's just observation. You might also want to make sure that your tubes are adjusted. But again, simple O-ring swimming pool one, a deflated soccer ball from Walmart. I mean, you don't have to have anything expensive. What's nice about the air are a couple of things. It's going to help you start to counter with this uterus, which is what we're working on. And it will counter all your movements, but it'll also let you feel that float. And you will have an increase of fluid. You will have a sac there. I want you to start working with that to your advantage as well as to the baby's advantage. As it starts to compact, if you don't have a good posture or movement around it, your breath starts going away. This will really allow you to be present with your belly. So as you've established it, just sort of a before and after, I want you to concentrate on one side. I'm going to go to the left because that's where the camera is. So what I'm thinking of is let's say I just was rolling a ball from the center of my navel down towards my hip. Just a slight back and forth. Rolling the ball, let's say, from my navel down to my hip. And that's the visualization that I'm doing. Now what I'd like you to do is bring your hand in a little bit more. Now I want you to feel, even if you're just a couple of weeks pregnant, of what it's like for that whole belly to come over. Now for those of you that are hardly pregnant, I want you to just, and for those of you who are pregnant, but just to breathe out. And then come back in. So breathing out, you're expanding that belly and coming back. So it's just a nice little move. And just explore your hand positions. And just notice, maybe the upper area of your uterus doesn't want to come over. Again, fear of falling, let's say, or just integration of movement. These complications come up with constipation, which starts to happen, and bladder issues in your longer you are with your pregnancies. And just relax and leave that alone. This is a great little thing, end of day. You need a little lower back stretch, whatever it is. And now I just want you to feel what it's like to go to the left versus go to the right. Now I already can notice a difference with myself. Now you'll want to do both sides. Right now I'm just showing you how to do one side. Just because, again, this is something you can do in bed. You don't have to sit and watch it always. That I need to be with you, but you're more than welcome. If you do it on one side and you want to listen to me again, just adjust it to the other side. Replay. So now to make this a bit more complex, with this lesson, I'm going to go along with my leg. Going along with the leg that I said go down on, you're not going to notice as much as a move. And now for this one though, because it's going to be harder to think of that ball, now I'm going to be pushing through with my right foot, just enough to tilt the belly. Where again, the reason I'm wanting to some kind of inflatable underneath you, because what you should start feeling with is how the belly, your baby and the belly come back to center. If you watch me here just to do all these lessons. Now for those of you who aren't pregnant, this is great for your lower back. This is great for constipation and feet. See, I can still do these movements, but it's going to be much more. See how my pelvis is doing more of the work. Pubic bone is crossing midline, hip joints. Again, this is a great lesson to do. I find it much nicer, in a sense, more understandable than the pelvic clock for some of you that have problems with that one. If I go along with the leg, this is what it looks like. But again, now with this, I'm having much more where I'm bringing the hip up. As your bone starts to soften, as you start getting ready to dilate, not dilate just yet, you want to be able to move around without pulling the pubic bone open. So again, with just these inflatables, see the difference now when I go left to right? I'm not doing it here and here through the pelvis. I'm just feeling what it's like to just float over. Just float over. See, and again, that's, again, where I haven't worked on that. You can see the difference than coming here. So my leg's going long. And I'm going to start at the top of the belly. Now I get it, your uterus might now just be this big. You want to, this whole chest cavity is going to be enjoying a pregnancy. And so you're just going to be doing that, but as I'm lightly pressing through my right foot. Just the pressing of the foot is going to interact you with the tubes. And you can just do that. But what that will help you is in the rolling over. Eventually when you're rolling over in bed, how your belly will come out more as you're enjoying the pregnancy. Coming back again. I would love your feedback. Subscribe to more. I have a couple of moms, which are very good friends, that are going to need this video. So I want to make this a weekly. For those of you that are nice, actively fit, again, it's not about doing it fast and jiggling around. I want that synchronized movement. I want that synchronized movement. For those of you who are working on lower back issues, this is getting out of a car. This is rolling over in bed. These are functional movements. But the main thing with the uterus is that it will counter, or should, with your tailbone. When it doesn't, that's when it starts to stress out your pelvic region, and that's what we're trying to avoid, to have a much more movement-based pregnancy. Thank you again. See you soon.